Local Edition. I'm Brad Pomerance. Thank you so much for joining us again. Our guest is Brad Sherman. Mr. Sherman is a member of the United States Congress. Sir, I thank you so much for joining us.
Good to be with you, Brad.
You bet. I want to talk to you about the political climate in Washington. When the Democrats lost the House in 2010, they lost a lot of their moderates because they were beat by conservatives from the Republican Party. So what we see now is we have more left-wing Democrats, more right-wing Republicans in the House, and it seems as if you have Newt Gingrich saying that this is the most important election since 1860. I mean, this is a polarized Washington, D.C. Am I reading it correctly?
I think the country is polarized. The primary voters, and most people don't vote in primaries, those folks are even more polarized. And you know, we get along fine as individuals, but politically, Congress is polarized.
So what's the answer then? Because what we're seeing is there's some very important votes that need to be made, dealing with deficits, dealing with debt ceilings. And the Republican Party, who traditionally has voted to support the increase in the debt ceiling, is being pulled to the right by Tea Party activists, and that is causing a lot of fits for the economy. I mean, there's some real fear on Wall Street over this.
Well, raising the debt ceiling doesn't poll well because people think, well, what you're doing is letting the deficit grow. The fact is, if you buy a bunch of stuff, that's when you've made the decision to spend. And you can't get out of it just by refusing to pay the bill. Even if you have to put the bill on your credit card, not paying for what you've already bought is not a good fiscal approach. Likewise, for the federal government, we have certain tax laws, we have certain spending laws. Those spending and tax laws have all been voted for by the Republicans. You can't fail to pay the bills when you've voted for those
I also want to
spending
talk
laws.
about Medicare. One of your colleagues, Mr. Paul Ryan of Wisconsin, proposed a solution which some have called pretty radical, which is eliminating Medicare as we know it today and creating a voucher system. Fighting words for many, do you see his proposal as one that is as draconian as some have suggested?
Well, Newt Gingrich calls it right-wing social engineering. I couldn't criticize it any more than that. The fact is that you create a circumstance where the voucher would cover only a portion, perhaps less than half of your medical costs. And then those seniors who could write a check for the rest of the insurance would be covered. And those seniors that got a voucher that wasn't sufficient to buy an insurance policy wouldn't have an insurance policy.
And then what would happen? Would it fall on the counties to cover? Would it fall on the states, the feds? Unknown.
Unknown, but you go visit County Hospital, and throughout their lives there are poor people and people with real problems who are used to being there when they get ill. But you take people who've lived middle-class lives and say, we're taking you to the county hospital, this is not going to react very well.
But it does beg the question, and that being, we have an issue with, let's call it entitlements, and people are living longer. And as a result, be it pensions, be it health care costs, be it Social Security benefits, we don't have the funds.
We need to bring down health care costs. We need to bargain for the pharmaceuticals rather than just paying the posted price. We need to be healthier. And what we've done so far, and I voted for the health care program, that's health insurance reform. Nothing in that bill makes hospitals any more efficient or brings down costs.
When you come back, let's talk more about healthcare reform. I'd appreciate that.
Look forward to it.
He's Brad Sherman. I'm Brad Pomerance. Back to HLN.